So, Maminas, welcome once again.
Thank you, sir.
So, first of all, Bessem was also, what is STI, what the courses in it, how we are, the treatment and everything.
Once again, thank you, Sir Randy, for this opportunity. And also thanks to Brown Talk Show for this privilege.
Yeah, Maminas, last comment section, we say I am a chin in Kakla.
Oh, okay. Me, I can be bantamity. I am some of the health works words no. I am mean shed and mean
chin.
Okay, but I'll try and blend it.
Okay.
Yes. Until me fa konye so ada Brown Talk Show. So mama yes our opportunity we you find
more subscribing Brown Talk Show, more subscribing.
Okay, you find educate the public about some health condition, and today we are treating STIs. When we talk of STIs, anything STI is sexually transmitted infection. Sexually transmitted infection. Infection, rare and sexually transmitted. I just say infection and we got it through sex. I just say it's being transferred through sex. Yeah, that's why we call it sexually transmitted infection. And there were various types of sexually transmitted infection. It being, as you said earlier, gonorrhea, it be a syphilis, it be a chlamydia. There were other sexually transmitted infections where though through sexual activity, not necessarily the sexual intercourse, but sexual activities like kissing, like cunnilingus or blowjawing. That is what the public normally call it, licking or blowjaw or BJ. Yeah, there are activities and yet necessarily penetrating by the sexual organs. Yes, but sexual activities. And some of these infections include human papilloma virus, herpes simplex virus, and we have hepatitis B. These ones, it's not necessarily through sex, but it's an act we do during sex. Yeah. And if the partner you are doing with is infected by that particular infection, it can be transferred to you. Some of the signs and symptoms are it shows or it comes out if obedient sexually transmitted infection includes blood in the private place, and or honor or feeling blood in the urine, or if we said beta fracture in the penis or bra on here the menses or any other thing, or on your bar or bemania there is blood coming. If you're near but there is blood coming. Sometimes there is discharge, especially in man, there will be a smelly whitish discharge. You know that this is not the normal discharge that every man ban. When you say beta fracture, a newborn, and a thick, a whitish, a yellowish, and it goes on. A man, there's a whitish discharge if you move back or Johnson, and sometimes there is itchiness or who feel say a honky cow and say beta fracture. Ne bema na no keka me go wa rashes mpo begu ano e ma no so sa rashes e begu ho ana ho keka no yeah and so can it goes a pain in urination or for jum so tia wo e mema ni say especially omuya gonorrhea na obi obetimi the 10 minutes ajum so ade na bank kitin e ban so mu ye ne ya nti ade no kwa na e ban kon obransa ade na ban ti pain during urination. There are a lot of other signs and symptoms, which includes abdominal pain, a boo or cry. It shows like fever, and with something like herpes simplex or human papilloma virus. Now we got it through cunnilingus or blowjawing. And we go here and to go now. No say there is a whitish something every day. Yes, people don't really take aside maybe a teeth or mouth problem, halitosis or ebi a enum yare no bi o wa na ye enum yare
okay enum yare the friend halitosis
obi a enum bon
there is halitosis what
it aside ebi o enum yare no ebi o wa na human papilloma virus no want to know cause that fighting something no and obo se be wo anopo that sorry dem ko no twitwe ne si anopo na no de or what daytime na ade na kasa be chese sa ma no aba ne num to mo wa na ade na forming hanu which on here attention. And you talked about the treatment
the causes
okay the causes. Oh yes, thank you so much for the awareness. The causes as the topic states or say sexually transmitted infection. The sexually transmitted infection meaning it's only gotten through sex because it's an infection that is transmitted sexually. Into STI is not just said if you have not had an intimacy with someone, you cannot guess it. And we have different intimacies. As I told you earlier, it's not only through sex. It can be through an activity like kissing, licking, that is cunnilingus and blowjobbing. Another thing that includes intimacy and it can be transferred. So we only get it through sexual activities. And you were talking about the treatment. Sexual transmitted infection, the best way to treat and the number one way, the sure way to treat sexually transmitted infection or to prevent it is abstinence. Yes, when you abstain from any sexual activities and if you don't trust the person, abstain.
But how can one abstain?
So assuming you have just one woman,
you know that
stay faithful.
Oh nah.
Abstain from other women.
We can, but I'm a man.
You can't. But the number one sure way, almost say akukoda ntem we nyam. So if you stay indoors, you won't get any problem outside.
But you know that at the same time, that one person too, that's another discussion for another day.
It will be another discussion. So the number one sure way we can trust fully is abstinence. If you abstain, you won't get anything. If you are not married, stay faithful and abstain from sexual activity. If you don't trust the person, if you don't know the health state of the person. Also, as I was talking about, staying faithful. If you have one partner and you stay faithful, you won't go and pick any infection because most of the time it's the changing of partners that brings about this thing. That's why mostly if someone gets sexual infection like gonorrhea or chlamydia, if you come to the hospital, they treat you, they'll tell you that go and bring your partner. Yeah. Because at the end of the day, if we treat you and your partner that is involved is not faithful, by still picking it somewhere, the person can still bring it back. So we tell you, bring your partner, and we counsel them to be faithful and also treat them medically. And also the use of condom, but it's not 100% approved.
Accurate.
Yes, because sometimes condom can tear. Yeah, condom can tear. It depends on the vigorous activity the person is involved and also how it's worn. It's not everyone can wear condom properly, no matter how you teach them. Some are always in a hurry, so air 10 being at the edge, yeah, it accumulates air, and as the friction, the thrusting is going on, it gets tears, and still the penis will touch the inside of the vagina, and it can be, it can cause the infection, assuming there is infection already in the vagina or from the penis. So condom can also prevent, but it's not 100%
sure.
Yes.
So what's the
and also the treatment? Okay, there is treatment. So aside you abstaining, you staying faithful, using condom. You can also have treatment, and yeah, you can have treatment. We have something called prophylaxis, and
what is it?
yes, where I won't tell you the name of the medication, but it's actually medication that sometimes people take to protect themselves if they are not so sure of the partner they had intercourse with. Immediately they do, and they feel like, no, I don't trust this person. This person is not faithful. We have a immediate prophylaxis that you can take to at least clean your system. And yeah, but I don't want people to be abusing drugs and also to be using the opportunity to do a whole lot of things. So I'm not permitted to mention the names. Okay. So we have the treatment itself there, and we have a prophylaxis that you can take to protect yourself. And
so, you can continue.
You talked about
the complications.
Okay, yes. Thank you. The complications. People think sexual transmitted infection is just a common thing, a simple thing. So sometimes people get it and they turn out using herbs or local something to treat it, and they don't treat it well.
Okay.
The moment they drink 1 or 2 things and 3 days, their itchiness is not coming. They think that is all.
That's all.
But honestly speaking, you have to sometimes even do a test to ensure that it's well treated, which they don't go through that process. And there is complication. If a sexually transmitted infection is not treated properly, there is complication it leads to. Especially with the women, assuming a woman gets sexually transmitted infection during pregnancy, it can cause stillbirth. It can kill the baby inside your womb, the uterus. That is stillbirth. So that child cannot even be born. If scan detected early that the child is stillbirth, is dead already inside the womb, they can operate and take it out. It can also cause neonatal death. Immediately you give birth to the child, it won't take long, and the child will die. It can cause deformity in children. Yeah, because some infections will affect the children's eye, and other things, and as the child is in the womb. And with the adult, it can cause cancers. Cancers like cervical cancer. Assuming a woman has gotten STIs many times because you are changing different men all the time and getting it all the time, and you are treating and it's not going, and you think it's gone, you get it again, you are treated. The more you treat it, the body becomes used to the drug you are using. So this time around, it won't even respond to the treatment. It can give you cancer, cervical cancer in women, and also in the gentlemen, it can give them prostate cancer. The prostate enlargement. It's not only old age or lifestyle or maybe not having enough sex or over having sex or this thing that causes prostate cancer. Sometimes having frequent sexually transmitted infection also can cause prostate cancer. So it's actually something that we have to take serious, especially the youth, because the youth is abusing the sexual life, because of the fantasy in it, and because of the advancement in it, the enjoyment, the ecstasy it brings. And these days, a lot of the youth have the perception that it's just for fun. So they don't care about anything. They meet in club, they meet in even anything. Let's go and have it. It's just.
One thing they don't know is
it has
to the low, let's say high.
Yeah. So and you have to ensure that the person you are doing with, sure of the person that he or she is faithful, taking care of himself. Because some of the STIs is not even a yo. Sometimes you can get it in the public water closet and those kind of things. An infected person can have it and will use a public washroom, and you will just go there and infect yourself. So we have to be conscious with all these things.
Okay. Thank you.
Thank you, sir.
Mama Ness, Madam Reniel Nyame. Thank you once again.
Thank you.
Thank you, God. Thank you for always coming through for us with your vibes, with how to educate us on certain things. We really appreciate it. My viewers appreciate it. Everyone appreciate it. Thank you for coming through once again. Thank you very much. Thank you, Madam. Awesome. Nice one. We bring you another episode of Brown Talk Show, exclusive. Oyano baby, Abanyano Brown Talk Show. Abanyano Brown Talk Show. Stand away educating and you know aware about Bono. Sometimes over below, but what was high. Only when you are for I am a cloud very free. Yeah, but it's just no. It's just a bad problem. Sometimes about who the check on you. Or also what to check. But oh yeah, because yeah, I shall what be on there. Bema so there. I didn't the for him there. Why? Just a room store. See, Madam Ness, when you're educated here, Mr. Say, yes, so go through there. You know the kind of girls are. Remember them say. Obaba could sometimes ending, no matter how faithful you stay, after ending, into more I am answer more club, who pay me, I am more Obano, Obapo, Bampu, I wouldn't be few part. My name Jarry, my like, who house here, as I don't know. Into it, remember, Madam, when you didn't the other everything. Into I'm kind of Madam Nyame, say, a best of my to Madam Nyame. Say, with my boy now, also why with my friend and I say with my contact on the baby and the phone and I say the social media and the step by also when you church maybe on maybe more with maybe sanama on us why church room tomorrow. Madam when so say what's there now I only want ever to down my
okay, thank you so much for the privilege. On all social media, being Facebook, Instagram,
X,
Twitter, TikTok, all social media threads. I use Renewal Nyame. Renewal Nyame.
No one has called, it's just one.
Yes, the Instagram is Renewal _ Nyame. Yeah, okay. But the Facebook Renewal Nyame. Okay. Everywhere Renewal Nyame. And the Renewal is RENUEL. Like renewal. So RENUEL. And then Nyame is NYAME. With my contacts, anytime you contact Brown Talk Show, they will give it to you. Yeah, just contact them and they will connect you.
Thank you, Madam Renio. Thank you once again.
Thank you, Tise.
We brought you another episode of Health Talk. So we hope to bring you next time again on Brown Talk Show.